Hi, thank you for choosing Fertility Pharmacy of America for your prescription needs. Today I'm just going to go over some basic techniques that might come in handy while you're using your medications from us. We're going to go over reconstituting medications, subcutaneous injections, and intramuscular injections as well. What I'm going to show you here is how to reconstitute diluent into a powder medication. We have several different powder medications that you'll be mixing. I just wanted to give you an example here of how that looks. So you're first going to wash your hands and set up your station. I have an alcohol wipe, my mixing needle, and my 2 bottles. You're then going to take your alcohol wipe and swipe it over the tops of the 2 vials. When you take your syringe out of the bag, it is best practice to put a volume of air into your syringe that's the same quantity of what you're going to draw out, just to equalize the pressure in the vial. So I'm going to use 1 ml as the example. You're then going to keep the bevel side, which is the open area on the needle, facing up. When you puncture the vial, I inject that air in, and then you're going to flip it over. Always make sure that the needle itself is in the liquid, or you might get unnecessary air into the syringe. And then you are going to slowly draw it into the vial. If you do get some bubbles, you'll just tap it out with your finger until the bubbles dissolve. Then after I have my volume into the syringe, I'm going to puncture the powder vial and slowly put the liquid in it. Always be careful when you're recapping the needle. What I call is the scoop method. So I put the cap out in front of me and I scoop the needle onto the cap just so you don't accidentally get a needle pick. Once you have the volume that you need in your vial, never shake the bottle, but instead roll it in between your hands like this until it is all dissolved. If you ever get any discoloration or particles in your vial, make sure to call your provider or your pharmacy, because you're never going to want to inject it if you've got particles still in it. That's it. So what you're going to do here for a subcutaneous injection is find an area of skin that is at least 1 to 2 inches from the belly button is the most common area to inject. Always make sure you alternate sites as well that are at least 1 inch apart when you're alternating your sites. You're going to take your alcohol wipe and cleanse the area and allow it to dry. Then remove the cap of the injecting needle. What I always say for subcutaneous, to make sure that you get it into the right layer of the skin, is to pinch 1 inch. So you're gonna wanna pinch 1 inch of the skin layer, take your needle, do a quick inject, release the medication, and then remove it. For intramuscular injections, there's a few different locations that you might typically use. It's going to be a little bit of a longer needle than any subcutaneous injections you do, just to make sure it gets into the right layer of the body. You're going to take an alcohol wipe and cleanse the area. You do not need to pinch for this one, but you're going to want to make sure the needle's at a 90-degree angle. Then do a quick inject, release the syringe, and remove it. Thank you for joining us for our injection training. If you have any other questions, you can always look back at your injection training guides or give the pharmacy a call. Thank you.